Hi, welcome to BiPAP 101. I told you you'd get tired of 101s. Eventually you'll graduate to 102. All right, a BiPAP and a CPAP both work the same way. They push air in and they let you exhale, let you blow air out. A CPAP is one pressure, continuous positive airway pressure. It's just one pressure when you inhale and exhale. A BiPAP is two pressures. It's a higher pressure when you inhale, and then it drops down to a lower pressure when you exhale. The machine I have right here in front of me happens to be a BiPAP, but they all hook up the same way. Okay, not everyone on a BiPAP uses oxygen. If they do use oxygen, we have an oxygen connector that hooks to the tubing with your oxygen line. And it hooks to wherever the connection is on your machine. This one happens to be in the back. Some are on the side, some are on the top. But again, they all work the same way. If they're not on oxygen, then you need to make sure this connector is not in line. Because what happens is, if this connector is there, the pressure is going to come out of here, so they're not going to be getting the full pressure that they're supposed to be. So then we have our CPAP hose. This is a standard. Some of them are slim lines, and if it's an infant or a small child, they will have a 10 millimeter tubing, a smaller tubing. But for right now, we're just going to talk about a standard CPAP hose. And what it does is it hooks to the bottom of your CPAP mask. This is a full face mask. A full face covers your nose and your mouth. It's for people who can't keep their mouth shut. I'm sure you know someone like that. So what it does is it should go across the bridge of their nose and in the cleft right underneath their bottom lip. This mask is too large for me. This is a large mask. So when I put it on, if I put it in the right position at the top, it's going to come down too far here. Okay, it comes underneath my chin. So this would not be a good mask for me. That's one of the things you have to watch. The main thing is when you have a mask that's the right size and the person has it on, then you want to make sure when you adjust it, it's not blowing air into their eyes. You want no air blowing into their eyes. To do that, you would do that by tightening the straps. Some masks have a little adjustment here on the top. Some of them, this piece right here, can come out and be replaced for a larger or smaller size. So what you want, again, is that mask to fit from the bridge of their nose to the cleft right underneath their lip, not like this. Okay? So once you get it adjusted here, then you want to adjust the sides. You're going to tighten it up. Now, when we lay down or lay back, our muscles in our face change position. So just because they're setting up and it's adjusted, once they lay down, you might have to readjust it. And again, the main point is to make sure it does not blow into their eyes. The machine will compensate for a little bit of a leak through this part. The machines have that built in. That's why it's important. When we set it up, we put in what type of mask you're using. So if you change mask, you need to let us know. So that's a full face. Okay, that doesn't fit me. Again, you don't want it blowing in their eyes. A small leak around here is good. If they sound like an elephant during the night, it's because they've turned their head. It's now created a leak, so it gives you a really loud noise. You just need to readjust it. This is a nasal mask. A nasal mask is just that. It goes just over their nose. I'm going to take the head straps off of this just to make it a little easier for you to see what I'm doing. This just goes over the nose. Again, you don't want it blowing in the eyes, and it should hit right above my bottom lip. Okay? You shouldn't have all this air blowing. A lot of times, if you have someone with a mustache, they cannot wear a nasal mask because it doesn't set flush, or else you have to put it too tight. So then they have to go with a full fat face. There's lots of different types of masks out there. So if they have something different, if you happen to have nasal pillows or something like that, it's a good seal. Don't want it blowing in the eyes, and you're good to go. A lot of machines you can add water. This one just happens, the door slides that way, the water chamber comes out. You should use distilled water, not tap water, because then you get the sediment, the mineral sediment in the bottom. The moisture is comfort. It's a comfort issue. It doesn't have to be a doctor's order. It's for comfort. If you have really dry nose and mouth and throat, then you can add the moisture. You can turn the heat up, you can turn it down. It's all about what's comfortable for you. Again, with either mask, any mask, make sure it's not blowing in the eyes. Make sure you have a good seal. If they're able to turn their head when you're fitting them, that's great. Sometimes, if you fit it with, and they have their dentures in, then they take their dentures out to go to sleep. Their face now changes, so it has to be adjusted again. At any point in time, if you don't have power going to it, make sure you're plugged in. This one plugs in the back. Some of them plug in at the side, or change to a different outlet and see if that takes care of it. At any point in time, if you have a question, please contact your healthcare provider. Thank you.